Health security and pandemics. Smile, Smart Last Mile Cooling System. Pamoja. Vula Mobile. Crowd Droning by Globi. Cyvos Anyone. MCare app. And Striata.
Hello, I'm Kitty Leal, the founder of Ideabatic. I spent 13 years building innovative systems in cryogenic temperatures at minus 270 degrees Celsius in places such as CERN, home to the Large Hadron Collider. In 2014, I took part in a hackathon at CERN, where I realized there's a big problem. According to the WHO, pre-COVID-19, 2 to 3 million children died each year of a vaccine-preventable disease, and 20 million still lack basic vaccinations. One of the reasons is that during the last few miles of delivery, the so-called last mile, vaccines become damaged by fluctuations in temperature. I founded Ideabatic to solve important problems with smart innovation. So what is a typical last mile journey? Health workers carry cool boxes with ice packs in hot weather and over difficult terrain. Bear in mind the vaccines must be kept between 2 and 8 degrees before injection, and these journeys can take up to 6 days. Current solutions, however, either freeze vaccines or last barely a day when in use. One of the issues is human error. For example, using an incorrect amount of ice, repeatedly opening the lid, and leaving the lid open throughout the session. Our solution is Smile, a patented smart last mile cooling system. Smile is the only last mile solution that reduces human error and spoilage. It is low tech and fail-proof. Our one ice pack design means there's no need and no chance of using the wrong number of ice packs. Once the ice pack is inserted, it can last for 3 to 6 days without power, while monitoring and displaying the remaining cool life. The self-closing door and air locking mechanism mean it's okay to forget to close the lid. Smile comes with a backpack in which it can operate. Users turn the dial to the desired chamber to retrieve their vaccines. Only minimal vaccines are exposed, so the rest stay cool. Smile will improve efficiency in many temperature-sensitive applications, such as critical research and end-to-end cold chains worldwide. Smile has been iterated, tested, and field-proven. We're entering the manufacturing stage and looking for early adopters. We'd like to work with MIT Solver teams to bring Smile to the field, the lab, and clinics to save lives and ensure critical research is uninterrupted. Let's spread Smile across the world.
Ten years ago, I visited a psychiatrist for the first time. He gave me an ADHD diagnosis, and it became a turning point in my life because it came that years late and some damage had been done. My name is Iregi Mwenja, the CEO of PDO Kenya, the organization behind Pamoja initiative. The reason it took me that years and many other Kenyans a chance to see a specialist was because in our country, only 0.7% of the health facilities, public health facilities, have a mental health unit. We have less than 100 psychiatrists, mostly deployed in urban centers. Our country, stigma is also pervasive, and some people who would know where to go for help don't even go for it because of stigma. And our culture is also a stumbling block. I left a well-paying job in Nairobi in the city and came back to my community to form a solution that we call Pamoja. Pamoja initiative trains task-shifted lay community health workers, deploy them in their community, where they become providers of lay mental health services and mental health champions. They are the ones who scout for people who need help, provide them with basic help, and then refer them to a PDO clinic. And also, they have a backup, a mobile backup unit, which can go to their locality and provide services on the ground. We target the socially disadvantaged and people who would otherwise not afford the mainstream mental health services. In 4 years, we have managed to reach over 10,000 people. And when COVID came, we were able to stand up to be counted and support our health workers who are working in isolation wards across the country. We started in 2017, and in our 4th year, we're hoping to become a SOVA, and by so doing, get affiliation and mentorship and support from MIT, which will help us with our immediate plans or our immediate goal, which is to scale by replicating this model and also diversify the range of services that you're giving. This is the team behind Pamoja, and this is the future of mental health in Kenya.
My name is Dr. William Mapham. My passion is improving healthcare in rural and underserved areas. This is the road to my first job as a junior doctor. It was an hour and a half to drive to fetch petrol and 3 hours from the nearest ice cream. And we worked very hard to improve healthcare in the area, but we had no access to specialist advice. Many of our patients had to travel huge distances to get to specialist services, often driving up to 7 hours. However, it was only when I was specializing, this is me specializing as an ophthalmologist, that I realized I was seeing patients, I was teaching students, more patients were waiting, and I was too busy to answer the phone that was ringing off the corner with people like me in the past trying to get hold of a specialist. So we built Vula to connect healthcare workers with specialists. It's a simple app, requires no training to use, and uses 20 times less data than WhatsApp. It connects the healthcare workers at the front line directly to specialists, and they call this connection a Vula. The specialists respond, and all the data is collected for health managers to manage their systems going forward. The response times from the specialists on Vula is less than 15 minutes, really bringing specialist care into rural areas. In 2014, we launched my specialty, ophthalmology. And in 2015, we were voted South Africa's most innovative app. In 2017, I left ophthalmology to go full-time onto Vula and to help connect more frontline healthcare workers with more specialties. In 2019, we were now available in 53 different specialties, and we were voted South Africa's best health solution. Last year, we were part of the national response to the COVID pandemic, and that work continues to this day. We launched a public helpline to help members of the public get access to advice. We had free testing for healthcare workers in both the public and the private sector. And we also used for the referrals to treatment centers. So right now, if you get COVID in South Africa, you might be referred on Vula to your nearest treatment center. The National Department of Health describes Vula as the patient referral system that is both the glue that holds the health system together and the oil that helps it work efficiently. Today, Vula is sent every minute, connecting a frontline healthcare worker with a specialist, resulting in a huge amount of data that we would like to make use of. Our team is extremely enthusiastic. We're unusual for a tech company. We're more female than male, and we come from 11 different cultures. For the future, Aru would like to use the opportunity to network, gain investment, and to help turn our data into AI reality that is useful in Africa. Thank you very much.
%40 of the world's population is at risk of getting affected by malaria. And every year, 230 million people in 87 countries are being diagnosed with malaria. The disease also costs about $12 billion to treat every year. And yet malaria could be prevented to a fraction of that cost. And one of the solutions to do so is to be able to identify malaria mosquito breeding sites and eliminate the malaria mosquito eggs before they become malaria transmitting mosquitoes. And that's what we're currently doing at Crowdrunning by Globee. Crowdrunning by Globee is a digital platform connected to over 3,800 drones in 87 countries, collecting image data with drones on demand. What was previously a lengthy and complex process for our clients is now being reduced to the simplicity of ordering an Uber, easy to order drone data on demand through drones anywhere at any time. Our solution is currently being used by humanitarian organizations such as UNICEF and research institutes such as Liverpool School of Tropical Medicine to help prevent malaria outbreaks in Malawi by identifying high-risk areas for malaria, and by being able to do so, allocate the resources to where they need to go and when they need to be there. The reason for why our clients are ordering drone data through Crowdrunning by Globee is that drone data is of much higher quality, making detailed analysis possible, such as finding malaria mosquito breeding sites. It's also in real time, where satellite data many times are lagging from somewhere between 3 weeks to even up to 2 years. Almost every day, we have new drone pilots signing up to Crowdrunning by Globee, which is great because we're growing at a quite rapid scale, enabling us to help prevent additional disease outbreaks and disasters along the road. It's also fantastic because it's a great way for us to be able to fuel the gig economy around the world by helping provide paid freelance gigs to drone pilots around the world. Last but not least, all our drones are battery driven, which is a very environmentally friendly way to collect data. The team behind Crowdrunning by Globee is a team of 10 very passionate, both tech experts and social impact believers, ranging from drone pilots to programmers to data scientists, and myself being the team leader, Helena Samsio. We are currently looking for more partnerships so that we can scale and hopefully not just prevent malaria outbreaks, but also other type of disease outbreaks and disasters around the world. And we believe that the partnership with MIT Solve could really help us reach that next stage. We hope that you would like to join our journey of creating a better future with drones. Thank you very much.
Hello, my name is Steve Zhu, CEO, co-founder of Cybal Health, where we're trying to deliver better health data for all. So our story starts 3 years ago. We were developing wireless sensors to allow for premature infants to be better held by their mothers, to eliminate skin injuries in this highly vulnerable group. And then COVID-19 hit, and we realized the same technologies we were developing for premature infants could be useful in the setting of pandemics, adult monitoring in both the ICU and the remote setting. And throughout this entire process, we're very proud to include the voices of both parents and patients in the design and operation of our technology. So enter Cybal's ANI-1 platform, the world's first ICU-grade wearable with direct applicability to infectious diseases. Rather than just measuring one or two things, we really measure them all. Vital signs from heart rate, respiratory rate, blood oxygenation to temperature and even blood pressure. This is the world's first device that's actually able to give you ICU-grade data on a continuous basis. It works with all mobile devices from Android to iOS, tablets, and smartphones, enhancing scalability across multiple different platforms. We've also done more than just simply develop sensors that report back vital signs. We've implemented new machine learning algorithms that actually can detect changes in your vital signs that can be indicative of asymptomatic, pre-symptomatic, or early symptomatic disease. We conducted a clinical trial with 325 subjects with close contacts that had COVID-19, funded by the US military and BARDA, to provide early alerts that may suggest that you should quarantine or get a confirmatory PCR test to prevent infecting others. We've built this platform around remote monitoring, allowing these sensors to connect with your phone. So again, compatibility with multiple different devices. That data is also safely secured and sent to a cloud where that data can then be made accessible to you as a patient, your provider, even healthcare administrators monitoring overall global health in regards to our sensor systems. All of this work is published in peer-reviewed journals at the highest levels. Our data, our outputs, our comparison against gold standard monitoring systems, demonstrating both technical feasibility and proving the value of our technology. We're an excited, mission-driven team of over 50 engineers, doctors, scientists, We're very proud of our partners from the Bill and Melinda Gates Foundation to Merck for Mothers, Save the Children Foundation, Anthem Health, and Draeger Medical. We're very excited to be an MIT Solve finalist, where we can focus on taking our technology and applying it to underserved populations here in the United States that are most vulnerable to COVID-19 and other infectious diseases. Thank you.
During the pandemic, MCare, an AI super app, transitioned to a digital compass that transmits geolocated data of index cases of contagious diseases from rural communities with no doctors to health authorities. I am Okoluwa Ashimi, the CEO of MCare. Today, I want to share with you the story of Ajite, living in Ladoga community in Nigeria. With a 24-person household, a persistent cough was a source of concern, as she put them at risk of an outbreak. When our community healthcare worker reached her, we were able to use MCare to reach a differential diagnosis of COVID or tuberculosis, both of which are diseases of public health concern. Our geolocated data was transmitted to the nearest primary healthcare center, and she was able to get the support and treatment she needed, saving the Ladoga community from an outbreak and herself. But Ajite is not alone. 693 million Africans living in rural communities with no doctors are at risk of a pandemic every single minute. This is why MCare is an important tool as such a time as this. Using our AI decision support tool, we are able to reach differential diagnosis for complicated diseases and definitive diagnosis for primary healthcare diseases, while alerting authorities of contagious diseases that are public health concern. This ensures that every single case gets the support and treatment that it needs. So far, we have treated over 1 million cases, and we hope to do more. Not just for the 693 million Africans living in rural communities, but 3 billion people across the world who also are at risk. My team and I, including our 250 community healthcare workers, who are our heroes going to every community to provide care, as well as Wale Sola, our in-house physician, and Marilyn, our AI machine learning expert, as well as myself, the pharmacist with an MBA, call on you to support our journey to ensure that every community is secure from a potential pandemic. Thank you.
In my country, stadiums prepared to vaccinate tens of thousands are met with a slow trickle of cars, while health centers facing urgent demand don't receive vaccines. When resources are scarce, precision matching supply to demand saves lives. But the data infrastructure for pandemic response looks backwards, documenting the past. Systems that explain what will happen next deliver time to prepare, time to allocate to the right points on the map. Strata is software that optimizes the supply chain, predicting what will happen across the site, the stock, the people who need care. Predictions help organizations triage. Strata makes predictions by learning from customer data and from public data, satellite imagery to social media to government statistics. Strata has been proven in Sierra Leone and in California, in Nigeria and in Mozambique. Here's the evidence. Strata generates a forecasting margin of error of within 1.5 vaccine doses for every 100 doses that are ultimately used across 4,000 sites in Tanzania, a 97% improvement over the approach used today. In Nigeria, in Mozambique, Strata predicts individual health-seeking behavior with significant accuracy, enabling health workers to reach 4 times as many people at risk. To send resources where they will be used effectively, you must know the condition of each site. Strata infers the capabilities of every health facility in Sierra Leone, every community health center in California. Strata is predicting emergency readiness. Strata determines where millions of dollars of investment is made to increase resiliency. Machine learning delivers increasing returns at scale. We've cut the cost of implementation by more than 50% each time we deploy Strata. MIT Solve resources and community will drive impact. This is our ambition. Scale Strata to 3 additional countries. Build the software as free and open source. Invest in capacity building. Pandemic response has been focused on increasing supply. It's not enough. Macrolize depends on local partners to support, to inform, to enable. MIT Solve brings partnerships for greater engagement, greater scale. Meaningful problems are multidimensional. Strata learns from hundreds of inputs, hundreds of different points of view to assess health systems. We have a diverse team distributed across Africa, Europe, North America to ensure multiple points of view. We've shown it's possible to predict what supply chains must do next to address shifts on the ground before they occur. Help us give more governments the tools to make health systems proactive. The world cannot wait. Thank you.